I'm going to take a little bit of a hiatus from our talks in order to honor a special person who's been part of the MS Center since its inception. Actually was here before I was here. I think many of you know Kathy Bennett, who's our MS nurse extraordinaire, and she has been the heart and soul of our clinical service. Many of you know how devoted Kathy is to the care and treatment of persons with multiple sclerosis. Her dedication's unparalleled. She has excellent clinical judgment, but she also is a very compassionate person, and I know many of my patients consider her part of their family. I've heard that time and time again. Kathy, I've been encouraging her to go back to school to get her degree as nurse practitioner because I think she's going to be a fantastic provider in that capacity, and she's decided to do so. As part of that move, her position has changed a bit, so now she is housed in the main neurology division. She's still in our department, and she's still going to be helping with MS patients, but she has more restricted hours. She's also going to be dealing with some patients with other neurological disorders, but she is still going to be an important component of everything that we do. We are in the process of recruiting a nurse practitioner in the meantime as our clinic is growing. We see the need for that, and it is my hope that Kathy will ultimately come back after she gets her degree and join us again. But we want to thank Kathy at this juncture. Here's a picture that I took. It's not very good. When she was receiving a well-deserved award from the university. There's something wrong with this mouse, so excuse me. There's Kathy. And Kathy, if you could come up, I'd like to present you with some flowers. And a card from everyone in the MS Center, and we hope you'll continue to be part of our life and our work.
I hope to. Thank you.
So I like to show this diagram because we're trying to build a multiple sclerosis center that's multifaceted, that provides excellent clinical care, and that's growing. We need more providers, and as I said, we just recruited Dr. Mal-Dreyer, and we're in the process of trying to recruit another MS specialist. But there's a high incidence of MS in this area, and all the doctors are also doing research. So we want to be available for our patients. And to do so, we need to grow. We started with one doctor, we're up to 4. We want to continue. We're combining that clinical care with cutting-edge research, both at the bench and the laboratory, to make basic fundamental discoveries, and we've grown tremendously with regard to that. We have collaborators at the university. We have 4 labs that are focused on MS research that are run by myself, Dr. Irani, Dr. Mal-Dreyer, and Dr. Roman Geiger, a neuroscientist who works with us. But we're trying to draw in scientists from all over, from biochemistry, from doctors who are working on modulating the immune systems for other diseases, and doctors who may know more about how to protect nerves from damage, and that is coming together nicely. And then we have the clinical trial arm, and that's being spearheaded by Dr. Braley, and she gets tremendous help with that from our clinical trial coordinator, Judy Radhoff, who's a very elemental participant in our team. And Judy, if you could stand up and so everyone knows who you are. So the clinical trials have been mentioned. We have a number of trials that are ongoing or recently finished. Dr. Braley mentioned that we're going to be recruiting for the OPERA trial, which is going to investigate the effects of this new, very promising drug, ocrelizumab. And we were involved in the trial of the alemtuzumab or Campath that looks like it may be one of the the next drugs to be approved by the FDA. That's the once-a-year treatment drug. And we also have been studying patients in order to understand the natural history of the disease better in a large study involving the collection of blood from participants every month, and we do MRI scans every other month, and we do special research MRI scans that are allowing us to gain better insights into how to monitor patients with MS and ultimately to discover new treatments is our hope. So in terms of the basic research, I mentioned some of the labs and collaborators, and I'm just going to go through very briefly a few examples of some of the research questions that we're posing and what we're trying to gain from them. First, we have a number of our scientists looking into what types of inflammatory substances are produced by the white blood cells that cause the damage in multiple sclerosis, and how the white blood cells in patients with MS, these are the inflammatory cells, differ from white blood cells from healthy individuals. And ultimately, this research, we hope, will lead to the development of new blood tests that aid in the diagnosis of multiple sclerosis, new blood tests that will help doctors to determine which drug is most likely to be beneficial in a given individual. As you know, right now, we have no way of knowing if a patient is better suited by treatment with Copaxone versus beta interferon versus Tysabri, especially in the beginning of the disease. And we're hoping that some of our studies will lead to the development of a blood test that will facilitate that decision-making process. And as we learn more about the inflammatory substances that are released in the brain and spinal cord that cause the damage, we can then be poised to design new drugs that could inactivate or neutralize those substances to protect the central nervous system. So I alluded to this earlier, but we've been doing studies on MRI and how it changes over time in different types of MS, as well as how the immune responses change over time. This will give us a better understanding of how relapsing remitting disease differs from progressive disease. Dr. Maldreyer mentioned that there are probably different pathways and processes that are more prominent in one stage than the other, and we're trying to get a better handle on that. Also, most of the clinical MRIs that are done today are most useful in demonstrating the inflammation that occurs in multiple sclerosis and also demyelination that Dr. Maldreyer mentioned, which is how the myelin sheath is damaged, and that appears as those white spots on the scans. But conventional MRI scans are not good at measuring or demonstrating the nerve fiber damage. So we are working with radiologists on refining some techniques to do that better. And hopefully, as we follow patients that we've done many MRI scans on over the long term, we may be able to gain some idea of how the MRI could be used to predict the clinical course of multiple sclerosis, how what your MRI scan shows today may be predictive of what's going to happen down the line. And here's an example of some of the type of work we're doing, where we're getting MRI scans on patients every month and looking to see if they develop new types of new inflammatory lesions. And we're getting blood work to see if that is associated with changes in the inflammatory substances in the bloodstream. And this is an example of some of the newer techniques that are allowing us to better visualize nerve fibers and the damage that's done to them during MS. This is a specialized MRI, and you could see these little lines are nerve fiber bundles that are emanating from the center of the brain up to the surface. And over time, in some patients with MS who've had a lot of attacks, these nerve bundles become thinner, and some of them are difficult to appreciate, and that's a reflection more of what's going on at the level of the nerve as opposed to the myelin or the inflammation. Dr. Braley has an interest in sleep disorders in multiple sclerosis, and she's gotten a grant to initiate some of those studies, and ultimately this may lead to new treatments for fatigue in multiple sclerosis. She's also embarking on a study to investigate the relationship between surgery and general anesthesia and MS attacks. There's this sense in the medical community that patients with MS may be more likely to worsen or suffer an exacerbation following surgery, but that's controversial and it may not be true. But that impacts patients' decisions on whether or not to have a procedure. It also impacts the management of patients following surgery. And so Dr. Braley is beginning some studies to see if there really is such a relationship. In addition to the MRI and the human immunology studies and the clinical trials, we also have teams of scientists that try to understand MS by studying an animal model. An animal model means that we induce an MS-like disease, generally in mice, in order to better understand the disease and to try new treatments before they're used in humans. And this just shows from a mouse in one of our studies. This is in the brain, and it shows a blood vessel, and these green blobs are inflammatory cells that are passing through the blood vessel wall into the brain tissue to cause damage. And that looks like what happens when a new MS lesion is forming in human beings. So we're asking a lot of different questions with the animal model. We want to know how inflammatory cells migrate to the brain and spinal cord, what attracts them to go there, and how do they penetrate through the blood vessels to get into the brain tissue and the spinal cord tissue to damage the myelin sheath and nerve fibers. Our ultimate goal is that these studies will lead to the development of drugs that block inflammatory cells from entering the brain. We already have one called Tysabri, and Gilenya prevents the white blood cells from leaving the lymph nodes and going to the brain, as Dr. Braley mentioned. But I think we could develop better drugs if we understand in greater detail how the cells enter the central nervous system, so that we could block the bad actors without preventing inflammatory cells that protect us from infection, from being barred from the central nervous system. One of our postdoctoral fellows has tracked inflammatory cells in the animal model to see where they go before they get to the brain, and he found that they go to the gut. And a lot of other scientists have also come to that conclusion. He just won a grant from the National Multiple Sclerosis Society to study that better, and ultimately his research could lead to a better appreciation of how dietary practices can improve the health of individuals with MS, and also to determine whether drugs that alter the bacterial content of the gut may affect the clinical course of multiple sclerosis, drugs like antibiotics or probiotics, since the cells go there and somehow change before they go to the brain. Dr. Irani's lab is looking into how viral infections influence the MS-like disease in animals. Many of you are aware of the fact that if a patient with MS has an infection, a urinary tract infection or a cold, they're more likely to experience a relapse or acute worsening of their symptoms, and he is using the animal model to understand what the connection is on the molecular and cellular level. And that could help us to learn how to minimize the negative impact of infections on MS and to increase our understanding of how vaccines might impact MS, whether certain vaccines are protective, but other vaccines may be detrimental. And finally, a lot of the work we're doing is to look into how the nerve fibers themselves are damaged by the inflammation. And we would, our big mission is to develop drugs that will prevent that damage and maybe even reverse it by triggering regrowth of nerve fibers and protect the nerve cells from the toxic substances released by inflammatory cells. And this, I'm just going to show a few quick slides that refer to those studies. Here is an optic nerve from a healthy mouse. So the optic nerve conducts the visual signals from the eye to the back of the brain, allowing us to see. And the optic nerve is actually part of the central nervous system and is attacked in multiple sclerosis. Optic neuritis or decreased vision in an eye is one of the more common presenting episodes of MS. So we use special stains in order to highlight the nerve fibers, and that's shown in red. So these nerve fibers are all arranged in a parallel order, and They're thick. You can see them nicely coursing from the top to the bottom of the slide. This is the optic nerve from an animal with the MS-like disease. And first of all, you could see that there's less red staining because there are less nerves, because some of these nerves have been destroyed by the inflammation. I don't know if you could appreciate, but there are some red blobs, and these are swellings of nerve fibers that have been damaged. We also used a green stain that stains the damaged nerves that are trying to regrow, and that's what this yellow coloring indicates. And there are a lot of inflammatory cells here as well. So we know, as in MS and humans, there is nerve fiber damage in these animals that have the MS-like disease. Here's another depiction of an inflamed nerve from an animal. These greenish blue blobs are actually inflammatory cells that have entered the nerve, and you could see that nerve fibers have been fragmented and they're swelling up in these little blobs. So here's another type of image of a nerve, an inflamed nerve from an animal, and here's a nerve fiber, and it's been damaged. It's actually been cut in half, and it's swelling at the tip. And these red blotches actually indicate the presence of inflammatory cells that have damaged the nerve. One of my postdocs made this move. So this is just a depiction in 3D of the damaged nerve fibers in the animal model, and the yellow indicates and the green indicates that these nerves are trying to regrow. So we know that, and these blue blotches indicate inflammatory cells. So we know that there's nerve damage, and there actually is an attempt of the nervous system to repair itself, but it's just not completely successful. So we want to learn how to capitalize on that attempt of the nervous system to repair itself to further encourage it with drugs. And this shows one way in which that may be accomplished. There's a certain substance extracted from fungi, actually, that have been found to stimulate nerve fibers to regrow. So when that's applied to the animals with the damaged nerve, you could see this is actually not an inflamed nerve, but it's a nerve that was subjected to a crush injury. And beyond the injury, you could see there's a lack of green staining. That means that the nerve fibers have died off. But here, when we give this extract to the mice following the injury, we could see that there's nerve fibers that are recovering and beginning to regrow. So we want to further study this and try to use the information to develop new drugs to stimulate regrowth of nerves in patients with MS. As part of our research effort, we are trying to increase knowledge and bring in different investigators from all over the university and even all over the country. We've established a lecture series. I just put this up because it's an agenda of speakers that have come or will come to talk about MS research at the university, and that occurs at least once a month. And we've also started a high-level research symposium that has taken place twice before. We're doing a third one of these symposia in October, and we have already gotten commitments from some of the top researchers and doctors in MS all over the world, from the US and Europe, and they all come here to share their research findings along with us and to discuss MS management and the newest findings in a clinical roundtable, as we're going to have today. So to end up, I just thought it may be nice for you to hear very briefly from some of our young scientists about what they're doing. I asked them to confine their remarks to about a sentence each. So if we have some of them come up. Okay, here's the best and the brightest, the new generation of researchers. And first, this is Heather Walker, who's a graduate student at who's a graduate student in my lab. Heather, why don't you mention what you've been doing?
Hi, I study T cells, and normally T cells are required for clearing certain types of infections, and my research focuses on what makes them pathogenic in an autoimmune disease like MS.
Okay, thank you, Heather. Okay, and here we have Amanda Huber, who's a postdoctoral fellow in our lab, who started several months ago, 6 months ago, or? 7. Okay,
Yep.
here you go.
So I study the blood samples from patients with different subsets of MS, and we analyze to identify factors, as Dr. Siegel said in the beginning of his talk, that may be used for diagnostic tests or also markers that would tell us a predictive value of whether lesions are going to form or if people are going to have relapses. And additionally, these could possibly be used in the future for better treatments.
And this is Julie Rumble, another postdoctoral fellow who's been with us for several years.
I'm studying a white blood cell called the neutrophil, which has previously not been targeted in MS, but we find that it's actually quite important to the mouse model of the disease that Dr. Siegel was just talking about just now. So I'm studying how the movements of those cells can actually affect the progression of disease.
Okay, thank you. And Josh, he's another graduate student.
Hi, I study, there are a couple different pathways into the central nervous system, and I study how immune cells get in and how they utilize those different pathways, and how that might influence where lesions form, whether they form somewhere in the brain or somewhere in the spinal cord. So that's my research.
Okay, great. Thank you. So these are young people who are devoted to making the next advances in the field, and it's a representative group. We have, I think, around 20 scientists actively engaged in projects right now at the bench. So I'm going to stop here, and now we're going to have our clinical roundtable that's going to be moderated by Dr.